पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। वाव!
Beds set aside in hospitals, testing ramped up at airports, and people rushing to vaccination centers to get their booster shots. As cases surge globally, India's bid to stay ahead of the COVID curve amid threats of a possible resurgence of the virus driven by a new and easily transmissible variant. This as the central government asked states to scale up their emergency response to COVID and conduct mock drills in hospitals from next week to ensure readiness of infrastructure and healthcare workers. In its advisory, the Health Ministry has asked hospitals to make sure that oxygen generating plants are kept fully functional and there is uninterrupted supply of oxygen, with enough oxygen cylinders kept as backup.
You can see that here is all the beds are connected with the central oxygen pipeline. The government has given us direction to be fully prepared in terms of oxygen, in terms of ventilators, monitoring, BiPAP, non-invasive ventilation, and all the manpower, doctors, technician has to be trained, because this time again we have seen that many countries are facing large number of cases. So this time we have seen that we have earlier experience of handling the COVID waves very effectively, and you can see that all our infrastructure is in place. We have more than 2,000 cylinder also, and we have concentrators also, and we have PSA plants also. We have 5 PSA plants operational, fully operational in the Loknayak Hospital.
Meanwhile, for international flyers, random testing on arrival and mandatory COVID negative report for those coming from Japan, China, Hong Kong, Thailand and South Korea.
It wasn't done. We didn't see this happening, and we had quite a big flight as well from Dubai, and in front of us no one was tested, and there was no social distancing maintained while boarding the flight. No one was wearing a mask. I think we are probably one of the named few that were wearing a mask.
Even as India's weekly positivity rate remained low, the registrations for the booster dose have gone up almost 14 times in the past 1 week. Like 32-year-old Delhi resident Chandan Jha, people with delayed precaution doses are rushing to get the jab.
अभी काफ़ी दिनों से न्यूज़ में चल रहा है कि चाइना में काफ़ी बढ़ गया केसेस और वहाँ पे डेथ रेट भी ज़्यादा है, तो हम कुछ ही से अलर्ट हो गए कि प्रिकॉशन इज़ बेटर देन क्योर, और हमने पहले से प्रिकॉशन के तौर पे उसको ले लिया.
Ramped up genome sequencing, robust infrastructure and adherence to COVID appropriate behavior. In the words of the Union Health Minister, this time India is looking at a preemptive and proactive response to COVID. With 3 horrific waves behind us, India is making sure that it's in a position to take on a possible surge in COVID cases well in advance. In New Delhi with camera person Mohammad Mursalin, Vedant for NDTV.